Good evening, everyone. My name is Michael Rouse. Welcome to ESF's Family Health and Wellness webinar presented by Nemours Children's Hospital. Thank you for taking the time to join us tonight for the first of many family and parenting webinars that we'll be hosting. Tonight, our topic is back to school prep, tips for a more mindful start to the school year. Before we get started, just a few Zoom webinar protocols. You can see us, but we cannot see you. Please know that. All participants are on mute, so please place your questions in the Q&A box for our expert doctors tonight. We have two of the finest who will be happy to answer any questions you may have. We ask that you try to reserve your questions until the end of the program because they'll be covering a lot of territory in their presentations. And we'll do our best to make sure that we answer as many questions as we can in the time allotted with us tonight. And finally, just as a reminder that this is being recorded so that you can share it with all of your friends and family members that were unable to join us tonight so that you can reference it if needed in the future. So to kind of do a quick overview, my name is Michael Rouse, Executive Director of ESF Summer Camps. Really excited to be with you tonight. And being a parent of 4 children between the ages of 2.5 and 9 years of age, I think we can all agree that the pandemic has changed our worlds permanently. As you know, ESF is in the camp business, and the feedback that we receive from our families over the course of this past summer and friends is one of the most key things as far as feedback of how we can make our camps better for our families, but also educate our families in anything that they can do, relating to parenting, our children, family dynamics, as well as how our children are growing up today. And so we reached out to our friends at Nemours, which is one of the largest integrated pediatric health systems in the country. Everything they do for medical care, research, education, prevention, and advocacy is focused solely on children. We want nothing but the best for our families, and we're really proud and excited by this new partnership with Nemours. Personally, I can tell you our 2.5-year-old, Naomi Grace, has had a few curveballs thrown in her direction over the course of her time frame since she's been born. And the team at Nemours couldn't have been more amazing with the multiple operations that we experienced and the care and the level of care. We were just so impressed, especially during COVID, if you can imagine. And so we knew every time we went to Nemours that we were in great hands from every single person that we walked in to meet with and to speak with. So we're really excited to have 2 amazing doctors with us tonight. Dr. Meghan Walls is part of the Division of Behavioral Health at Nemours Children's Health and provides outpatient therapy and behavioral and developmental wellness consultations. She also recently joined the Nemours Children's External Affairs Division as a legislative and policy advisor and analyzing and advocating for healthcare policies that benefit the children of Delaware and surrounding states. As the Delaware Psychological Association's advocacy chair, Dr. Walls has pushed the telehealth that reaches all families in need of mental health care and has also worked to integrate mental health into COVID-19 testing centers by providing resources to communities in need, including a list of Spanish-speaking telehealth providers and having mental health professionals available at walk-up community clinics. Dr. Walls has served as the state legislative to lead the Delaware chapter of Moms Demand Action for Gun Sense in America, and she's initiated efforts to address violence in schools as a member of the Red Clay Consolidated School District Parent Advisory Council. Our other expert, Dr. Rellosa, is a pediatric infectious disease specialist at Nemours. He completed his undergraduate studies at Georgetown University, went to medical school at Temple University of Medicine, did his general pediatrics residency at Thomas Jefferson University at Nemours Children's Hospital, and did a fellowship in pediatric infectious diseases at Children's National Medical Center in Washington, D.C. During fellowship, he worked as a medical officer for the FDA and also worked at St. Christopher's Hospital for Children for 6 years before returning to Nemours in 2017. He's a board certified in both general pediatrics and pediatrics of infectious diseases. Dr. Rellosa is the HIV program director at Nemours. Delaware, and heads the COVID-19 associated MISC working group and associated COVID-19 vaccine education efforts. I'm going to turn the program over to them, and they will, they will actually lead you through some of their great presentations, as well as we'll at the end we'll turn it over for some questions. So welcome, Dr. Walls.
Thank you. And thank you for being here to those of you who can attend. And thank you to ESF for partnering with us. We're always happy to get parents information. I'm glad we took good care of Naomi when she was here. We aim to take care of kids in all the ways that we can. And as a psychologist, I love to hear that we're taking care of families' needs too. Can you go to the next slide, Stephanie? So I wanted to just, we're going back to school. We are now going into year 3 of COVID. And Dr. Rellosa will talk a lot sort of about the medical side and where we are, but I like to give parents sort of an overview of how COVID sort of disrupted our kids and then where we are now. So when we think about back to 2020, when we had lockdowns and we had that terrible online schooling for many of us who are parents with small children at home. So Michael, I have 2 young ones too, and had a kindergartner. It was not the best of times. And so I think when we think about what happened then, it sort of makes sense that we need to think about how COVID is affecting mental health, and then how do we prepare moving forward for now where we are. So we had a lot of unknown. We had unknowns about what would happen next. We sort of lost the sense of time and purpose. Our kids had more social isolation. Adults had more social isolation. And usually when kids have these negative or irrational thoughts that are sort of based in anxiety, like, what if my parent gets sick and dies? What if a grandparent gets sick and dies? We can sort of help them think through what are the chances of that. But during COVID, it got really scary for kids because we couldn't actually give them that comfort of saying, everyone's fine, everyone will be okay. They were kind of seeing things happen around us. So this is where we were back in 2020, right? Next slide. And what we know is that there is some research on what happened to kids during that time frame. I am not going to read every word on the slide, but I like to have it here for folks to kind of look at. And I know we're recording this, so if you want to go back and you think stats are cool, great. We have this whole thing up here. But what does this say overall? So where they did most of the research was in places that had the highest rates of COVID, like early on. And so they were seeing some of what was happening later in the year. And what we are seeing when we look at studies from other countries is basically that there was an increased prevalence of things like depression in kids, anxiety in kids, both of those at the same time. And when we looked at parenting, I think this is the stat I'll call out. Almost 86% of parents, when they looked at Italy and Spain, towards the end of 2020, were saying there was some change in their children, right? 86% of parents are saying COVID had an effect on my family. It doesn't mean it was profound, right? But it means there was some increased stress or distress around what was happening in families. And so I think this is important as we think about moving forward. I don't like to gloss over this because it's not the end of the world. I will talk about what we can do, but I do think it's important to remember that many of probably your children, from young kids, right, all the way from our 2-3-year-olds all the way up to our adolescents, really had this different experience during COVID. Next slide. And so when we look at the US, we say, what happened here? Because that we're not living in those other countries. And so was it different here? We have really limited clear data, but the CDC, looked a little bit about, this was in 2021, about what was going on. And, I write this down because kids don't live in a silo. And 11%, or 1 out of 10 adults, had said, yes, they considered suicide in the last 30 days. That stat is unacceptable, right, for how we are doing in terms of our mental health. But that's where we were after a year of COVID for adults. Who is taking care of our children? Adults. So I actually think we need to also think about families. How are we all doing during this? How are parents coping and kind of getting through this? And when we looked at increased mental health concerns, we saw a lot of increase in what we call like crisis concerns. So kids presenting to emergency rooms, kids who needed, some help. And these stats, the 30% increase in teens 12 to 18, and 24% increase in kids 5 to 11 are what we were seeing in our emergency rooms. So kids who had pretty severe or significant concerns. At Nemours, I think the most I think the biggest sort of impact of stat that we saw was that we actually had an 80% increase in emergency room visits for mental health when we looked at 2020 to 2021. So again, I'm not being all gloom and doom. I promise we'll get to better, but I do think it's important that we reflect on what our kids have endured and where we are. The other thing that's really interesting is that there is this increased rate of ED presentation and suicidal ideation, but not necessarily completed suicide. And I actually think that gives me some hope that people are talking more about mental health than we ever were before the pandemic. And parents are bringing their children because kids are more comfortable to tell their parents. And so while I don't love some of these stats, I do think that what we're seeing is more of a sense of I can get help and I should get help. We can go to the next slide. So what do we do now? Thinking about all of these backgrounds, right? We're thinking about the fact that we have higher mental health, difficulties reported. Parents are more stressed. And I know Dr. Rellosa will talk a lot about things like mitigation strategies, but when we're talking to our kids, we have to really think about where we are now. Where are we currently in August, September of 2022, and where have we come from? So the biggest thing that I think is important as we reflect on where we've come from and where we go as we get back to school is, what are our schools doing and how can we prepare our kids? So schools will choose different mitigation approaches, and that might depend on where you're living, on the rates of COVID, all these things, right? But explaining to your kids what's going to happen is really important. And as parents, even if we are frustrated with what that looks like, kind of feeding it to our kids as facts. We know your desks are going to be further apart, your lunchroom's going to be smaller. Some schools are still doing these things. Some have sort of gone back to the old normal in terms of spacing, not masking, but we want kids to know what is going to happen. And then the next, couple weeks before school starts, thinking about how can we practice those things at home? How can we work together to get our kids ready? And giving your kids this warning that, mom, dad, grandma, who's ever taking care of you is giving you the best information we can. But I think as adults, we all have watched this pandemic have waves and go up and down and rules change. That's really hard for kids. So saying to them something like, this rule or this masking or not masking could change during your school year. And as soon as we get that information, we will tell you. So many of the kids who struggled with these things were just unprepared for it. And so practice, right? If you've got little guys who their school might go back to masking, let's practice masking at home again. This is not, to be, we're going to do this one thing forever, but just to prepare them for going back. The other thing that I think is incredibly important every year, but I think especially this year, when I think about last year when we started school, some kids went back and some didn't. Some went back masked. This is the first school year since COVID started that I think many schools are going back to what I'll call a regular schedule, right? So we are going to get our kids on the buses or dropped off in the morning. They're going to be there all day, every day. And so getting back to consistent schedules and routines. That, again, I tell parents this every year, but bedtime is probably the thing that I harp on the most with my families as we get ready to go back to school with my patients. And that is for those little guys going to preschool, and that is all the way up to my teenagers. Your toddlers and your pre-Kers and kindergartners are going to be exhausted when they start school. Get them on track ahead of time, and it will make all the difference. Parents are often shocked when I say I really love like a 6:30, 7 p.m. bedtime all the way up to age 6, and they don't love that because it's hard for parents who work, and I get that, but the earlier the better for those younger kids. For our school age kids, everybody should be in bed by 9. It is not perfect. I understand this. I have my own small kids, so I can understand the bedtime fights, but I think it really is important that we at least try, right? This is our effort to get them on time. The other thing is, if your kids are anything like mine, they've gone from camp to babysitters and they probably eat, I don't know, yogurts at 5:30 at night. So getting kids back on consistent meal times is really important too. What does that look like? Where will we go to lunch in school? Making sure we're doing that. And then kind of preparing ahead of time. What's our morning going to look like? What clothes are we getting ready? What school supplies? Anything that sets the stage that you're not sending kids back and they don't know what to expect after we've been in this pandemic for 2 years. Next slide. So what can we do? We can take some preventive approaches as well. So in this transition period, this photo that's in here is basically to what we'd use to explain that all kids have different personalities, right? And all kids have sort of different ways of being. And some kids need the perfect soil and the perfect amount of water, the perfect bedtime, the perfect meals to really thrive. Other kids can grow in cracks, right? You can give them nothing and they just thrive. And so we know kids are different and we need to plan for time to kind of reacquaint. The other thing I talk to parents a lot about is providing positive reinforcement and sort of a behavior plan in advance. And I don't mean a formal behavior plan where we're checking off things, but saying things like, in the morning, I'd love if you would get your backpack and shoes ready. And, that is your job for the day, and making sure that then we're following through with that. For young kids, and when I say young, I mean any kids in the elementary, even early middle school, the rule that we follow is whatever gets attention wins. So what does that mean? That means if your kid is screaming on the floor and that's the only time they're getting you to respond to them, right? That is what they're going to do. If you are responding when they are getting up on time and they are getting those things ready and they are coming home and doing homework, and you are really pouring on that positive reinforcement, they're going to kind of get in the groove of doing those things and feel really positive about them and hear from you that it's a good way to start. The other thing is just consistent rules, right? So we're going to go to school at this time, we're going to go to bed at this time, but knowing what's coming next. And then the last one is if your kid has a specific concern, they're worried about COVID, they're worried about return to school, just kind of thinking about, can I reach out to school ahead of time now versus waiting until we get started and then we're sort of panicked about what's happening next. Next slide. So what can we do? I really like sharing these ideas. These are not COVID specific, but I will tell you, I've used these more with kids since COVID because I think kids have a harder time regulating than ever before. And I think the reason I love giving some ideas like this is because parents, I think, often want to do what's right and want to help their kids, but just don't know what to do. And so some of these things are, really easy. I always tell parents, your kids can control how they react sometimes when they're not 4, but they can't control how they feel necessarily. So we don't want to tell our kids, don't be angry, don't be upset, it's fine, don't be frustrated, or don't be nervous about going back to school. Instead, it's, I totally hear you. You're mad, you're upset, you're nervous. What do we do next together? And amazingly, even our teenagers need that, right? What do we do next together? So some of these things, which are, I think a little, from all the way from little kid ideas up to older kid ideas, but I think really help because it gets kids into the actual actions of doing these things. So, this calm jar that I have up here, a picture of, is we'll do things like put like sparkly glue and things in a jar, right? And I'll let the kids shake them up and we'll wait it all fall to the ground. And that's when they're it's their calm jar. Kids love doing these things, but you can talk to them about, you might be nervous about school starting. You want to do an activity with me? We can do things like catch them being good marble jar for your little guys, right? So, and when I say little, again, all the way through elementary school. So they do the things you need them to do in the morning. They're getting marbles in there. And by week 2 of school, they've earned themselves a prize. And then other things like belly breathing, which for little kids, I call balloon breathing, right? Breathing in deep in our bellies and out. But for older kids, and I'm happy to share in the chat later, but there's a couple really great apps that I love for older kids that are wonderful for helping them do some deep breathing. And a lot of times we sort of assume our teens and our older kids don't need this, but I actually think they're probably the ones who need it the most going back to school. We've seen that teens are affected the most. And the last thing I'll say on this one is, I often tell parents, prepare to be ready for school. And listen, I know this is not all realistic because I'm often the mom being like, I got to be in clinic in 30 minutes, get your shoes on, we got to go. But if you can plan to be ready 10 minutes before you have to leave and have your kids sit down, take a few deep breaths, relax in a chair, it actually really helps the mornings go more slowly as you're getting back in. We can go to the next slide. When your kids get home from school, talk to them about school, but don't say, was your day good? Yeah. Was your day not good? Meh. How was your day? I don't know. Right. Ask them questions that they'll actually answer. Who did you sit with at lunch today? What was your favorite thing you learned today? We have a jar on our kitchen table at home that has questions like this because my kids think it's super fun to pull them out at dinner. Know that your kids might not want to talk right when they get home. That's okay. Let them have a snack. Let them relax. Don't kind of press them when they first get home. We know that kids sometimes need that decompressing just like we do. And then also, I put this picture up here because one of the things that I found the most helpful is actually doing things like talking to your kids while you're not, sitting staring at them and doing other things. So I think generally, making sure you're having these conversations is a great start. All right, we can go to the next slide here. Really quickly, I just want to drop this and then we're going to go to kind of some tips and I'll pass it over to Dr. Rellosa. The one thing I want to say about kids is that what we know is that we can expect a cohort of kids. We are not post-pandemic. You'll hear Dr. Rellosa say loud and clear, we are not post-pandemic. But when the pandemic, if we get to a point where we're really actually level and we're seeing less illness and we are seeing some less death, but really get to a clearer point, that was when I will feel comfortable saying, where are our kids? Our kids are still in this. They're still going through it like we are. What we know is that about 5% of kids will struggle at the end of the day. So a year out from this, when we really are back to normal, about 5% of kids will still have symptoms. But the most positive thing is actually a caring adult. So if you were on this webinar, you were already probably doing that. A caring, consistent adult. Obviously, social supports are great also, and I have some of these things, but a caring adult is really the best thing for our kids. Next slide. So just really quick, when to seek help if your kids have any kind of behavior changes significantly, calling your pediatrician, you can call a mental health professional if you already have one on hand. And the other piece of info I put in here, and I'm glad we're recording this, if you have a teenager, anyone over 11, I love talking to teens and saying, lots of kids struggle sometimes. They get sad, stressed. If you ever feel like you're in crisis, do you know there's a phone number you can text? I don't know about if you guys know this, but teens love texting. So I have tons of patients who would never pick up a phone and call someone or even tell their parent, but will text this number. So if you're a parent, encourage your teens to put this number 741-741 in their phones. Every state in the US has this. It finds out where you are and it sends you a text back. All right, Stephanie, I think we're on to our last one here. So, school years are always a change. We want to prepare kids, want to watch for changes in their behavior. We want to communicate with teachers. And really, if we have concerns, I think the biggest piece of advice is to reach out to those professionals to help, get our kiddos on track. And I'm going to wrap up and hand this over to Dr. Rellosa. And I think we're going to do questions at the end.
Hey, good evening, everyone. Thank you, Dr. Walls. That was really informative, especially as a parent also, in terms of learning some things that maybe I can put in my armamentarium in terms of dealing with my kids. And thank you, ESF, for having me and us tonight to kind of talk about things. I'm going to take a obviously different approach as a pediatric infectious disease doctor and kind of talk about as you as parents are thinking about going back or having your kids go back to school and what we know about COVID, or what we thought we knew and what we know now, and helping you maneuver. So if it's okay with you, I'm going to share my slides. All right. Can you guys see that? Okay. So I think, as Dr. Walls pointed to, we've been in this now close to 3 years. And when I think about what we thought at the beginning of this pandemic and where we are now, that's changed dramatically. And at the beginning of the pandemic, this is sort of kind of the general sentiment I heard a lot. Well, children don't get infected by COVID. They don't have significant symptoms or severe symptoms, even if they do get infected. They don't transmit infection, so we don't really have to worry about them being a part of the spread of the infection. And children are not overall affected by the pandemic. And as Dr. Walls is pointing to, there's multiple ways, even from a mental health standpoint, that we see. But we'll talk about other ways that children have been affected. So what do we know now? Well, I think it's obvious that we know that children get infected, and while it may not be at the same type of impact that we've seen in older people or adults or even older children, they do get infected at the same rate. And we'll look at some brief graphs to demonstrate that. Most of the time, children either are asymptomatic or usually have mild symptoms, but children, and take it from someone who has seen them here in the hospital and is taking care of them, can get severely sick, especially those with underlying health conditions, of which we'll talk briefly about. And as we know, now we're getting deeper into the pandemic, and we're talking about things like long-term effects from an infection, or what someone might refer to as long COVID. We know that children are not an exception to that, and that long-term effects of COVID infection do happen. Children do transmit COVID-19, especially in households and while participating in other activities with children, which includes school. And so we have to think about that. They are, again, not immune to being a part of the story about how we think about putting strategies and mitigation in place to prevent spread of COVID. Pandemic has affected children in multiple ways. As Dr. Walls already pointed out, learning, education, I put learning there twice because it's important, I guess, has been obvious, and that's what we're kind of talking about here tonight. We've seen delays in routine vaccinations and access to care, which has been a big problem in terms of exacerbating chronic conditions in children and missing out on other vital vaccinations that will prevent disease. We've seen increased rates in diseases like diabetes, and as Dr. Walls already pointed out, mental health illnesses, depression, anxiety. And, you know, I always think in terms of other pandemics or epidemics. We've been dealing with a pediatric obesity epidemic for a long time now. And what we did see during the pandemic is probably things that are going to worsen that epidemic in terms of decrease in physical activity for lots of different reasons, again, both from a standpoint of mitigation strategies and then also general health and mental health. And then it really has exposed, the pandemic has really exposed a lot of the racial and socioeconomic health disparities and inequalities that we already do. And I think that I would be remiss if I didn't point that out, and that not only do we have to address our physical ills and our mental ills, but also our societal ills. So this is data from the CDC that you can access yourself through the CDC website, but I bring it up, and it's relatively up to date. It goes all the way to August 6th. And I think for a lot of us, we can see in terms of the weekly cases per 100,000 per age group in the United States in this graph. Our children under 17 are represented in, or the age groups for children are represented in the yellow groups. And you can see children have been no exception in terms of following the same ups and downs surges that we've seen throughout the whole pandemic. You look towards the end of this graph where we are now, and you can see over the last several months, several weeks, we've had an uptick in some cases. Thankfully, we are seeing a little bit of decrease. And so to the point that Dr. Walls said that I would make is, yeah, we're not out of this pandemic. Things are different. Things are better in some ways, but we need to still consider that and be prepared for upcoming months, upcoming weeks, if we are going to be shrewd about it. I know it's not just about the number of cases, because again, we are at a point because of vaccination and better treatments and better diagnostics that we can recognize COVID and be able to deal with it better. And so we're not seeing as severe, but we are still seeing patients admitted to the hospital. The graph on your left shows the 0 to 17 statistics, and you can see in the last couple of months, we've had an uptick in the number of patients that have been admitted to the hospital for COVID. And so we can't ignore the fact that we still have people who are severely infected, although it's different, that everyone isn't going to be just mildly affected or asymptomatic, and we need to account for that. So a lot of the questions I get from parents are, well, are my kids at risk? What do I have to worry about? Well, as you can see, even when there is all the way to the left of this graph, even when there is no known condition, we see quite a few pediatric patients hospitalized. I think where we're worrying the most, though, are patients that are suffering from obesity. I already mentioned the obesity epidemic that we see here in the United States, and those patients, and that's what has played out here at Nemours of what we see. But you can see a number of different conditions that we need to consider, even including asthma, which I think many of your children may have. And so, while yes, there might be certain children who will be more prone to being admitted to the hospital if they got COVID. There's still multiple conditions and even otherwise healthy children who might end up in the hospital. Probably in the news, if you've been following it as things have happened, you might be familiar with really one unique aspect of the pandemic when it comes to kids, and that's the condition that we newly discovered during the pandemic, which is called multisystem inflammatory syndrome in children, or MISC, or MIS-C. So this condition happens after someone has been acutely infected, a child has been infected about 4 to 6 weeks, and it can affect, as the name implies, multiple areas of body, causing inflammation and causing potentially severe disease. And when we've seen a lot of the patients who've been admitted for conditions related to COVID, it's been about MIS-C. And so part of the way we've thought about pediatrics is thinking about MIS-C, because even patients who have been mildly affected by COVID with their acute infection can end up having MIS-C. We also know that patients who have not been vaccinated for COVID have more of a predilection for getting MIS-C. The good news, though, when it comes to MIS-C is that when we look at the data over the last several months, is that we've seen a pretty steep decline in the number of cases. Now, that could be for a number of different reasons, including changes in terms of the variants we're seeing, but also due to vaccination. It's something that we are following closely, but something that we need to keep in mind as we continue on into this pandemic. So Dr. Walls mentioned that I was going to mention mitigation strategies, and I think the ones that are listed here, you all are probably familiar with. I think we all know now what social distancing and isolation or quarantine meaning, and we've implemented it, especially in schools, in various ways. Well, it has its good points. The further we stay away from each other, the less likely are going to transmit. But it's also had its negative impacts in terms of that it has disrupted learning and caused alienation and isolation for many children. And so while yes, we're going into a school year, while things might be different, there's going to be various changes, and we as parents have to kind of think about how that impacts our children and do what we can, because we're not going to have control over everything, to help with that. Masking is still a very important part, both masking in terms of you wearing a mask, so if you're COVID infected, that you're not spreading it, and also helping prevent. Masking is not perfect, and especially when we're talking about for younger children or children with special conditions or special needs, masking may be difficult. But, and again, we're going to see variations in terms of masking as we head into the school year. It's still an important part to think about in terms of mitigation. Testing, diagnosis, and treatment. Well, we are now at a point where testing has become more readily available, which is good, but we also know that the accuracy of testing, depending on what type of testing we see and when we're testing, can be flawed, and how we interpret it may be flawed. And so we need to think about how that plays into things. And we do have treatments now, even for children, that can be effective in terms of mitigating symptoms for children, although again, they're not perfect, and there are limitations from that. Finally, we're in an era of the pandemic where we have vaccination all the way down for children 6 months of age. I think a lot of people mistakenly thought about vaccination as going to be the be-all, end-all in terms of ending this pandemic. But when we think about it, it is only part of it. And what we know is that each of these individual strategies have their limitations when used alone. But they're most effective when we use some sort of combination, right? Because we're not going to be able to do all, and there's very reasons why, but what we can do and we can do in combination will be the most effective in keeping us safe. Well, what should we expect when we go back to school? Well, as we said, the pandemic is going to continue, and there's likely to be surges as we see new variants. Schools and communities will have varying and different mitigation strategies to deal with COVID. And we as individuals and as parents and as families need to figure out how that factors into our life and our quality of life and what we're going to do. In addition to COVID-19, we've seen significant variations in viral infections, respiratory viral infections, including things like influenza, and when they present, and it's thrown everything topsy-turvy for us infectious disease doctors, and they're going to be circulating in the community. So we have to not only think about COVID-19, but other things like influenza, and making sure we do other mitigation strategies to help prevent those diseases, like vaccination. While the definitive duration of immunity, both from natural infection and vaccine, are still not fully known, vaccination, as I mentioned, is an important part of protecting children in infection and severe disease. And so for the last part of this, because I know it weighs heavy on a lot of parents, whether you've already decided to vaccinate your children, whether you're considering, or you've already said no to vaccination, I think it's important that we go over it, just in case you still have some questions. So this is the first vaccine using the mRNA technology that has been made available to the American public. But this has been researched and studied for decades. And really why it's been studied is to do exactly what we did with it, to make a vaccine that is effective and safe, and be able to do it on a large scale quickly during something like a pandemic. It does contain genetic material of the virus, which then gives our cells, our immunity cells, on how to make proteins that are unique to the virus, but it doesn't change our genetic material. And so our worry in terms of that somehow alters our genetic material that's not how it works. Like all vaccines, mRNA vaccines benefit people by giving people protection against disease like COVID-19 without risking potential serious consequences of getting sick. So you're not going to get sick from the vaccine, because that's not the way these things are engineered. And they've been vetted just like all previous vaccines through the FDA, through the same regulatory processes. And when we have seen side effects, like what many people know, like the inflammation of the heart, or what we call myocarditis or pericarditis, it has been manageable, and it's been rare, especially rare among children. And things like infertility really are, when we get down to the science, are implausible when we think, because me as a scientist who's worked with vaccines and all, I still don't understand when people say that when they talk, well, it could cause infertility. I don't know how that would happen and have thought about it. So why should we vaccinate for COVID-19 for children? Well, protection against infection. Yes, we see breakthrough infections, and that can happen, but you still have a decreased risk of getting infected and possibly transmitting to other people if you are vaccinated. As I already pointed out, it helps to prevent severe infection, including hospitalization and death. And although that has been a small problem of pediatrics as compared to adults, it's not, pediatrics is not devoid of that. I mentioned MIS-C, which is one of the unique problems of the COVID pandemic for children, and how severe it can be, and vaccine has helped to prevent that. We also know that it may help prevent long-term symptoms, or what we call long COVID, from happening in children. And from a greater good standpoint, it's helping in terms of preventing infection for the very young infants or elderly or immunocompromised who can't receive vaccination. So I'm going to end with these two last slides to show you where we are when it comes to vaccination. This is a slide from the CDC showing the vaccination rates pretty much to date per age group. And you can see in our youngest group represented on this, we don't have enough data to show in terms of under 5 years of age. We are at a big gap when we're talking about fully vaccinated, and even when we're talking about eligible as compared to other age groups. And if we acknowledge that this pandemic and COVID has been a part of the lives of children, we have to look at this as a problem. And when we talk about that underage group and parents' expectations, as now that we have it available and it's only been a short period of time, you can see that 43% of parents who were surveyed in this poll by Kaiser Permanente are definitely not going to get their younger children vaccinated. And that's a problem, and we need to think about that. So I'm going to end there and let you guys ask questions to me and Dr. Walls, and I'll turn it back to you, Michael, in terms of leading the discussion.
Thank you, Doctor. And thank you, Dr. Walls and Dr. Rellosa. So great presentations. as Stephanie is just pulling together all the questions that all of our families are sending us, just wanted to kick off with one for you, Dr. Rellosa, and two for you, Dr. Walls. Dr. Rellosa, is there, as parents, you start to hear and read about things that maybe your children should take to battle against COVID-19, whether it be vitamins or certain types of, kind of supplements. What do you have to say about that? Is that simply a myth?
So I'm not going to say it's simply a myth. I think that anything that can keep you healthy, including vitamins and things like that, are important to think about. And I think for general health, it's an important thing. Unfortunately, like many other types of infection, there is no magical vitamin or medication that is going to absolutely keep you or prevent you from getting infected from COVID-19. I think the one thing that I would say, not to sound like a broken record, would be to, if you haven't already, to encourage your children who are eligible to get vaccinated, because that is, like I said, a large part in terms of prevention and hopefully ending this pandemic.
Great, thank you very much. Dr. Walls, these two questions kind of work hand in hand. Screen time for children, what is too much? And then consistent bedtimes for some families that have multiple children in that, kind of 3 to 10-year-old range, unfortunately, you don't have different like flight times where one's going off, then the next one's going off. Like, what is the right time? And I've always heard and read, the more hours you can get into bed earlier before midnight, the better. Obviously, for young children, you were mentioning in your presentation, 6:30 is not early, is not too late, too early. So, love to hear more about both of those questions.
Sure. So, I think the general screen time answer that I often refer back to is the AAP's guidelines, which are, 0 for our really little kids, about 2 hours for most of our school age kids. Screen time has changed though, too, because a lot of our kids are on screens for school. Some kids are staying virtual. Even in schools, a lot of kids have Chromebooks. So not all screen time is created equal. If they are doing something educational, certainly different. What I actually tell parents is I want screen time to be monitored. That is my biggest concern, is that I see lots of kids floating down a YouTube hole or something like that. So, I want the time monitored, but I certainly also want the content monitored. If your kids are playing math games, that's very different than, watching videos at 10 o'clock at night. And then secondarily, what I tell families is I want your screens off a half hour before bed minimally, because what we know is that kids' brains are stimulated by screens in a way that they are not by, say, a book, right? And so even if they fall asleep, they're actually getting less sound sleep when we look at sleep studies. So that kind of does tie to your second question, right? Which is bedtime. So it is very difficult when there's multiple kids in the house. I will tell you, I have 2 of my own kids, and we have a family of friends who are staying with us this week, and there's 3 of their kids, and bedtime is a fun adventure over here. And so what I often say is, first of all, if you can get into a routine where you can have kids going to bed at different time, that's okay. And being a parent and making those rules is completely acceptable to say, my 4-year-old is going to be in bed by 7:30 or 8, and my 10-year-old gets until 9. And I'm going to keep, my sanity by breaking a half hour between there to get one down before I go to the next. But you're right also in that we want to think about hours of sleep. So what time do your kids have to get up and count backwards? When we think about kids' sleep, what we actually know is that most kids need more than we think they do. So, they've really extended the sleep time. So for school age kids, like 9 to 12 hours, not 8 hours, right? And most kids need the 10, 11 hour range. So counting backwards, if you're a family who doesn't have to get up till 8, maybe you can stretch it a little bit later. But if you're a family whose the entire house is up at 6, we're getting those older kids to bed a little earlier too. So I think we're getting as many hours in and sort of ending screens before bedtime is the way to get kids the best sleep we can, especially for families who are busy and have homework and sports and all of those different things kind of flying at us on weeknights during the school year.
Great. Thank you so much. I know we have a couple others. So Stephanie.
Yeah, I just want to be mindful of time. We have time for one more question. do you all have any suggestions or tips for helping kids stay positive and maintain a positive attitude, especially when they're doing things they don't like homework, wearing a mask at school, those types of things?
Yeah, I mean, I think, as a psychologist, my first bit of advice is not to assume that your kid is not going to want to do that thing and to sort of talk about it and model it. So if it's masking, wear your mask in stores with them, practice it now, show them that the adults in your house are doing the same thing. If it is something like not wanting to get dressed for school, not wanting to go to school, talking about it as tell me one good thing that you're going to do today, and really kind of amping them up, because so often our kids are actually reflecting our personalities or our anxieties. And so a lot of times I'll hear parents say, my kid is so nervous to go to school. And I'm like, well, what are you like in the morning? And they're like, well, I'm really nervous about the kids going to school. So, kind of reeling it in a little bit and thinking about how you're talking about things. But it doesn't have to all be positive. We can go back to what I said before. It's fine to say, you're really nervous today. I get that. Let's work on that together. So not sort of sugarcoating, but, trying to get the positives in there as well.
Great.
I agree. I mean, as a general pediatrician too, I agree in terms of modeling is a huge part of this. And being, I think we often underestimate our kids about being able to have honest conversations with them in terms of pointing out when things are bad or when things are. And I think that was kind of point of a lot of what we're saying tonight. Yeah, we have to be honest and point out some of the bad things that have been going on during this pandemic and acknowledge that they might still go on, but also pointing to some of the headway and the good things that, we now know and we can do and make a difference, and pointing that out to kids.
All right.
Dr. Walls, Dr. Rellosa, one last parting tip for any of us parents that are, about to start school. Is this going to be Groundhog Day again that we just have to prepare ourselves mentally for as parents? Or, are things starting to get a little bit, sunnier out there and we need to be more positive with our kids about, no, this is going to be okay. What would you say?
Again, I think it's important to be realistic and say, hey, yeah, there's still some things that we need to work on. But I think positivity is such an important part of this, right? Because we are definitely different from where we are 3 years ago. And we're, no matter what, we're probably never going to go back to where we were 3 years ago. And that's probably a good thing in terms of, because we know more and we understand more and we have other options. And I think that's an important part to point out to kids.
Yeah, I would agree. And the thing I would add is, I agree. I try to be positive with kids, but also developmentally appropriately honest with them, because I think kids know when we're sort of putting on a happy face and doing a dance. But secondly, it's okay if the first month of school is terrible, an adjustment, and everyone is sort of feeling that, out their way. It does get better, but I think if we stick to some of these tips, both from a medical perspective and a sort of mental health perspective, we're setting our kids up the best we can. But we know, I'm a parent, Dr. Rellosa is a parent, we know things don't go perfectly. And so I think to expect that a little bit too, and be able to roll with that and let your kids know things aren't going to be perfect this year, but we're going to do our best and we're going to do it all together.
Well, this has been a fantastic evening. Thank you, Dr. Walls. Thank you, Dr. And thank you for joining us. If you have any additional questions from tonight's presentation, feel free to send us an email at info@esfcamps.com. And I want you to know that Nemours has an incredible website that has great resources and videos on it at nemours.org, as well as kidshealth.org. It's a great library of information and quick tips should you need it. In the meantime, we please enjoy these last few days and weeks of the summer, wishing you and your children a healthy start to a wonderful school year. And again, thank you for joining us, and we hope you found this webinar worthwhile and helpful and informative for you and your family. Have a great evening. Thanks again for tuning in.